Many Americans are suffering from chronic neck and back pain, and this type of pain can dramatically impact the quality of life, including physical and sometimes even mental health issues. So if you're suffering, don't give up. We have our back and neck pain expert, Dr. Christopher Miller, here to help us out. And today he's here with one of his patients, Monica. Thanks so much for joining us for 8 West today. So Dr. Miller, let's talk about this. You were saying that a lot of people are really suffering from neck and back pain.
I mean, that's what we see in our office. And, you know, like we just spoke before we started filming, you know, with COVID, everything's different. And so a lot of people are using technology these days, and that does create a lot of stress to our necks and upper back. Sometimes even in the chair use, it can affect the lower back. But the patients we deal with usually have more of a chronic condition that's been building up for many, many months, maybe even years or decades. And a lot of times when they get this chronic neck or back pain, it's due to degeneration of the spine. One of the most common conditions we see is called degenerative disc disease, where those pads and spacers where the intervertebral discs actually start to dry out and thin down, and then those vertebrae in our spines become closer. They start pinching on these nerves, and that is many times what causes that chronic neck or back pain.
Yeah, so, you know, you think about just kind of the workflow even over the past several months. We're 14, 15 months into this pandemic. Even people that typically would get up and move around at work are doing those Zoom calls, conference calls from home. So you have a lot of people doing a lot of kind of this stuff. So Monica, what exactly was your story? Because you seem awfully young to me to be someone who's had some chronic problems with back and neck.
Yeah, I had no idea I had an issue even. About 2 months ago, I just started waking up throughout the night, my arms completely numb from the elbows down. They started to even burn and ache. I mean, there was a point I was in tears. So I would be up constantly throughout the night, just trying to get what I thought was just the blood flow back down into my arms and fingers. I didn't know what to do. I actually saw Dr. Miller on, I think on this show actually, and went and saw him, and I started working with him and figured out it had something to do with my neck, actually, my neck and my arms. So.
Yeah, so what was the diagnosis? Because I know you start with a complete analysis, including x-rays. So what was Monica's story? Yeah,
so, you know, we spoke at her consultation, and, you know, it wasn't the blood flow, it was the nerves in her neck that were affected, because these go into the arms and hands. You know, I was not sure what we were going to find because she is very young, but you know, we did the exam on her neck and back and arms and hands, took a couple x-rays, and I was pretty shocked to find that in her lower neck she had very severe degenerative disc disease. So even if you look at these models, most people should be over here with a thick disc like that. Monica's was more like this already, and you know, then the bones get closer and it started pinching on these nerves. And but that's what her issue was, and so she was a great candidate for DRX-9000 therapy, and we've been working with her on that over the past few weeks, and you know, she's doing a lot better now.
Yeah, so let's talk about that, the DRX-9000. How is that a tool that allows you to really give a patient relief so dramatically?
I think the main thing, Terry, is that it's actually working on fixing the cause of those symptoms. It's not just trying to mask the symptoms. And so it's actually a medical device. You can see on the image here and we can work on the neck or the lower back, or sometimes we do one and then the other. But it's very specific to one individual level of the spine. So, you know, if we find that there's one level that's really causing it, it focuses right on that level. But it's a very gentle stretch on that specific area. And when it works this way through the aid of computers, it tricks those muscles around the area to loosen up, and then it stretches that disc and actually will draw nutrients and fluids back into the discs so that they literally rehydrate and start to thicken up and regenerate. And that's the reason the patients do so well, is that it actually helps get their discs and their spines healthier, so that they can go live a normal life once again.
Yeah, so Monica, why don't you tell us about sort of the progression that you made? How quickly did you find relief?
Very quickly. Within about 1 or 2 sessions, I started to get relief. And then now I'm sleeping through the night completely. So it's been great.
Describe sort of your overall physical health. You seem like somebody who's probably been used to being very active, take good care of yourself.
Yeah.
When you started having these issues, how surprising was that to you, and how important was it that you found somebody that could treat you without having the shots and surgeries and those sorts of things?
Very important. Prior to all this, I was working out like 4 times a week minimum. when the pain started with my arms, I stopped. And obviously, when I figured it out, it had to do with my neck. I wanted to be very careful too, because I wasn't sure, how much activity could affect that. But now I'm just getting back into working out, and also we had just opened a business, Grand Rapids Botanicals. We had to push that back about a month just so I could get my treatment in, so I'd be able to, actually do that. So it's meant a lot, and I have my life back, basically.
Yeah, was it important to you to not go the route of injections, medication,
yes,
surgery, that sort of thing?
Yeah, I was not interested in that.
Yeah, okay, so Dr. Miller, let's talk about why she was able to get such relief so quickly.
Well, because we treated the actual problem that was causing her pain, and Monica's a great patient, has done what we've asked. These are complete programs, Terry. It's not usually just one treatment. What we found is the combination of the right treatments at the right time creates an effect that really is a healing process for our patients. And I'm just very happy for Monica and her fiance, because again, opening a business is a big deal, and now she's feeling better. They were able to do that. I think they opened last week, and she's a lot happier. You can see her smiling and rested.
Well, I know,
again.
when you get good sleep, that definitely makes a huge difference.
Yeah.
And so she's obviously young, but you treat patients of all ages, and they're able to find relief through this process.
Yeah, and sometimes the programs vary depending on their situation, but I've worked with as young as 17 years old with injuries to their spine, all the way up to a patient that was 99 years old. And they've all done great, and it just gives them the quality of life back that they're looking for.
Yeah, and so if we have somebody sitting at home and they're suffering, how would you suggest that they reach out to you? And you do have a special for 8 West viewers.
We do. Even if your doctor has told you nothing else can be done, I would urge you not to give up. Call our office today, and for $49, we'll do a consultation and a physical examination of their spine. And as a bonus for the first 3 callers, we'll do a free MRI review. So if they have their MRI, I'll go through that with them and show them what's going on as well.
Good. Well, thank you so much, Dr. Miller, for stopping by at West today. And Monica, congratulations to you and your fiance with your new business.
Thank you.
And doing that, hopefully, pain-free, right?
Absolutely.
Yeah.